So the first homeostatic imbalance that we're looking at here that will affect the respiratory system is the chronic obstructive pulmonary disease, or COPD. COPD is actually two integrated problems. Usually it affects the chronic smokers. This is the single most important risk factor for COPD is tobacco smoke. First problem that smokers will have is the breakdown of the elastin in the connective tissue of the lungs. And the breakdown here of the elastic tissue of the lungs can result in trapped air inside those air sacs. And as the air gets trapped inside the air sacs, it's going to be more difficult for a person to bring more air in to allow the exchange to take place. This trapped air is going to result in emphysema, which will cause the increase in the volume of the lungs. Another major problem that will be accompanying the COPD, other than emphysema, is the chronic inflammation of my airways. Chronic inflammation of the airways gonna cause the obstruction of those airways, reducing the ability of a person to get more air in his air sacs. So as a result, not being able to move air inside my air sacs, I will have abnormal ventilation perfusion coupling. I'm not able to allow normal ventilation to take place, allowing air in and out, although I have normal perfusion, although I have normal amounts of blood reaching my air sacs. And as a result of having less gas exchange taking place, I will start to develop hypoxemia, low blood oxygen levels, and also hypoventilation. So why do I have hypoventilation? Although my problem is in the ventilation, I need to actually breathe more in order to increase the amount of oxygen traveling to my lungs. And from the lungs then to my blood. So how come I have hypoventilation? What do you think? So I have hypoxemia, I have low oxygen in the blood, but in the same time, I have hypoventilation. I have decrease in my respiratory rate. This simply can be explained because a person here is going to be taking more time to get the air to travel through the obstructed airways. So he needs to breathe deeper rather than faster. I need to breathe deeper, and when I breathe deeper, the pressure of air that I'm breathing will be able to pass the obstruction to reach my air sacs. This is why a person with COPD will develop hypoventilation. Asthma is characterized by coughing, dyspnea, and wheezes with chest tightness. This is an active inflammation of the airways that precedes bronchospasm. So they will have the same problem as the COPD, but only at the level of the airways. So I have an acute obstruction of my airways, which will result in an increase in my airway resistance. And as I have an increase in the airway resistance, it becomes more challenging for me to get the air to pass through those tight airways. Airway inflammation is an immune response caused by the release of interleukins, production of IgG, immunoglobulin E, and the recruitment of inflammatory cells. So I have an aggressive immunological reaction, getting a very strong inflammation due to the exposure of pollens or dust or whatever that triggers this inflammation to take place. Airways, in this case, will be thickened by the inflammatory exudate, and the chest tightness will be magnified by the effect of the bronchospasm, so the contraction of the bronchi. TB is an infectious disease that results from a bacteria. We call the bacteria here is the Mycobacterium tuberculosis. Symptoms will include fever, night sweats, weight loss, racking cough, spitting of blood. If the cavity filled with the pus did actually cause the rupture of a blood vessel. Treatment entails a 12-month course of antibiotics. We usually use 3 different types of antibiotics to kill this bacteria. It's a really debilitating problem for those who develop it. Looking here at lung cancers, this is going to be the leading cause of cancer death in North America. 90% of all cases are resulting from smoking. 3 most common types of lung cancers include squamous cell carcinoma, which will develop in the bronchial epithelium. So if you remember, the bronchi are lined with columnar cells. So how come do I develop squamous cell carcinoma in a place where I have columnar cells, not squamous cells? Simply because of the years of getting exposed to smoke, this causes the irritation of those cells. And as those cells get irritated, they start to proliferate, forming more layers of cells and more layers of cells. The top cells will be squamous in shape as they move away from the connective tissue, which will act as a source of nutrients and oxygen. So as I keep proliferating the epithelial lining of the bronchi, the top cell layers are going to become squamous cells. And those squamous cells, if I don't stop smoking, they're still going to be irritated, and the irritation of the squamous cells here at the top will result in the formation and the development of squamous cell carcinoma. Compared to the adenocarcinoma, will be developed in the peripheral lung areas, which are mainly formed of the air sacs. And remember, air sacs are going to be lined with 1 row of flat cells. And those flat cells, those squamous cells, once they get irritated, they start to increase in size and they will become columnar cells. And as I keep irritating now the columnar cells, this can result in the development of the adenocarcinoma. Small cell carcinoma, those are resulting from cancerous lymphocytic cells. They are lymphocyte-like cells. They originate in the primary bronchi and subsequently metastasize the rest of the lung and will be metastasizing other organs as well. Our last homeostatic imbalance that will be related to the lungs is going to be the cystic fibrosis. Cystic fibrosis is the most common genetic lethal disease in North America. It represents 1 in 2,400 birth. The problem here is in a faulty gene, CFTR gene is going to be faulty, and this will result in the formation of viscous mucus. So try to imagine, rather than having liquid lining, like water lining the airways, now I have jello lining the airways. So this thick mucus that I'm releasing is going to be serving as a favorable site for the bacterial proliferation, and so the inflammation of the lungs, chronic inflammations and recurrent inflammations of the lungs can cause the lung fibrosis and long-term lung damage over time. Any questions? Any questions?